May is BPD Awareness Month, and I wanted to bring back out the book by Dr. Fox, Complex Borderline Personality Disorder. So I'm going to be reading from page 36, The Symptoms Identify the Diagnosis. So this is also after a story from a man named Martin is shared in his journey to identifying his BPD and comorbid conditions. So the story of Martin illustrates the challenge often seen in those with BPD and co-occurring or comorbid conditions. The clinical picture can be so full of symptoms that it's not uncommon for all involved to get overwhelmed. In Martin's case, and perhaps in yours, when all your symptoms overload your ability to control your emotions and behaviors, your probability of treatment dropout and misdiagnosis increases. It took Martin being admitted as an inpatient for an extended period for him to finally receive and accept treatment. In doing this, he was able to reach a level of stability he hadn't achieved before. You may have been on a similar roller coaster with your BPD and co-occurring conditions. This doesn't mean that you and everyone else who has BPD and co-occurring conditions need to be admitted to the hospital, but Martin's symptoms, behaviors, and threat to himself and others was so extreme that removal from his environment and placement into a safe and structured setting was needed. Once removed from that environment, he could detox from the drugs in his system, and he was given medications to stabilize his mood. Once under control, a pattern of thoughts, feelings, and behaviors emerged that led his treatment team to identifying the BPD. One reason his BPD remained is because there is no medication for personality or personality disorders. Medications help or lessen or control what's called surface structure content, but it can't do that for core content. Surface structure content are the behaviors or symptoms that rise to the surface as a result of the core content. So let's break it down. Core content makes up the internal part of yourself that represents how you think and feel about yourself, others, and your world. Core content can include a sense of worthlessness, abandonment, emptiness, vulnerability, or feeling invisible, for example, but it's not always negative. We all have positive core content as well, such as determination, integrity, resolve, and independence, to name a few. Identifying core content is a critical step in managing surface structure content and controlling and/or lessening your BPD. So surface structure content includes depression, anxiety, panic, anger, and other emotions, but it also includes behaviors such as acting out aggressively toward yourself or others, promiscuity, idealization and devaluation, negative self-talk, and giving up right before success is achieved. The heart of the problem. Martin's journey is an example of the complexity involved when someone has not only a personality disorder, but also other comorbid mental health conditions. The problem is that many mental health providers are trained to recognize and work with surface structure content only, such as depression, anxiety, trauma, and others. The addition of a personality disorder intensifies surface structure content, and in many cases, it becomes intractable due to the intensity of negative core content. Mental health providers aren't typically trained in identifying and working with core content, and therefore you and your mental health provider may find yourselves continually trying to lessen the impact of your issues with little positive outcome. When there is minimal identifiable change, both of you feel frustrated, stuck, trapped, annoyed, and hopeless, and you're more likely to prematurely terminate treatment or get dismissed. Identifying and working to manage and control core content are paramount to long-term change. So here's an exercise. So consider this. Is it core or surface content? When you recognize your core and surface content, you become empowered to take greater control over your thoughts, feelings, and emotions. By doing this, you're able to replace maladaptive patterns with adaptive and healthy ones. So below is a mixed list of core and surface content for you to identify. On a new page or in a journal, draw a line down the center. At the top of the left column, write core content, and at the top of the right column, write surface content. Read each word, and if you think it's core content, write it in the core content column. If you think it's surface content, write it in the surface content column, and use the box below to check your answers. So here we have the words emptiness, shame, dissociation, acting out, abandonment, integrity, self-harm, promiscuity, grandiosity, worthlessness. This is a very important exercise as it builds your insight into your thoughts, feelings, and behaviors. Recognizing what drives your urges to respond helps you see that you're not powerless in an uncontrollable cycle of stimulus and response. There's a driving factor, and knowing the difference between your core and surface content will help you control it. And here's the answer section for what is core versus what is surface content. Strategies even like this, such as identifying your surface and the core content, can greatly improve a sense of control and empowerment over one's life and over our thoughts, feelings, and everything. It makes us feel that we are not just the disorder. And it starts with little steps like this to taking back your life.